This is a public service announcement for rabies. So what is rabies? Rabies is a viral disease that affects the central nervous system of mammals and is often fatal. Causative agent pathogenesis and virulence. So what causes the disease? Rabies is caused by a virus belonging to the Rhabdoviridae family. Characteristics of the virus. The rabies virus is a bullet-shaped enveloped virus contained in a helical capsule. The virus is composed of single-stranded RNA and contains 5 structural proteins. How does a rabies virus cause an infection? The virus is inoculated into the human body via a bite from an infected animal. The virus may then enter the peripheral nervous system and migrate to the brain or replicate in the muscle tissue. The virus then invades the central nervous system where it starts multiplicating. From here, it spreads to other organs in the body.
Transmission and epidemiology. Transmission of rabies. All mammals are susceptible to and can carry rabies. Once the virus has made it to the central nervous system, where it can be spread throughout the body, the infected animal is rabid, and its saliva contains the virus. How does a person acquire the virus? People can get rabies in a couple different ways. Most commonly is through the bite of a rabid animal. Another way of transmission that is less common is from scratches or open wounds that are contaminated with the saliva of a rabid animal. And the last known way of rabies transmission is inhalational, where it's mostly lab workers that are dealing with the virus. What increases the risk of infection? Rural areas, wildlife occupations, and veterinarian workplaces all increase the chances of getting the infection. Basically anything that puts you around more animals will increase your risk. Prevalence of rabies in the United States and in world population. India has the highest number of cases, averaging at 25,000 cases per year due to the rural areas and lack of public awareness. The United States averages around 1 to 2 cases per year, and the United Kingdom has eliminated all cases over the past few years, which is where we look to be in the near future.
What happens if you get bitten by an infected animal? Seek medical attention, even if you aren't sure you've been bitten. A vaccination will be provided by a healthcare provider. So how do you know for sure if you might have rabies? The animal that bit you is sent to a state lab so a necropsy can be performed. There are several tests that are performed to diagnose rabies. These include direct fluorescent antibody test, histologic examination, immunohistochemistry, and electron microscopy. The brain of the animal is tested to see if the virus is present. The test results are completed within 48 hours. If the results come back positive, the patient is vaccinated. What happens if no medical attention is received? Without treatment, rabies is fatal. The central nervous system infection is apparent. In up to half of the patients, hydrophobia is seen. This fear of water is the result of pain associated with drinking. There are also seizures and hallucinations. In some cases, paralysis is the only symptom, and this may lead to a respiratory failure. Following the neurological phase, the patient becomes comatose. Because of this phase, and including respiratory paralysis, death follows.
Prevention is key and can be summarized into 3 simple steps. 1. Avoid unfamiliar animals, because as you know, all it takes is a bite or scratch, and any animal can have rabies. 2. Keep your pets immunized and make sure all their boosters are up to date. By doing this, you will protect your animal and in turn yourself. And 3. Get vaccinated. Protect yourself. Contact your local healthcare professional today to find out the best option for you.